Hi Pearson viewers, I'm Dr. Celine Saulnier, owner of Neurodevelopmental Assessment and Consulting Services and an author on the Vineland Adaptive Behavior Skills 3rd edition. I want to talk to you today about some questions that I keep getting asked about how to respond to Vineland items during the COVID-19 pandemic. As many of you know, the Vineland assesses for everyday, practical, and independent skills that are current, usually within the past 3 months. However, we don't want to skew our diagnostic judgment by considering behaviors that are out of an individual's control. So here's my advice. If you are assessing a disability like intellectual disability or autism, and you need the information to make a diagnostic judgment call, then I would say encourage parents and caregivers to consider their child's behavior prior to the pandemic, even if it is farther back than 3 months. Because we really want to know from a diagnostic perspective, was this individual socializing, going out in the community and having play dates and going out with friends and sleepovers, things they can't do now, or even their daily living skills. Were they taking care of their bathing needs and their dressing needs and all of that all of us have let go during COVID? However, if you are trying to determine the impact of COVID on an individual's presentation for something like depression, then by all means, I would say consider current behavior. Unfortunately, you're not going to see the answers to these questions in the manual because we just weren't predicting a global pandemic when we developed the measure. So use your clinical judgment, consider the diagnosis at hand when making these considerations. I hope this was helpful, and I'm wishing you all a very happy and healthy New Year.